taking the time to attend. For individuals that don't know me, who might be tuning into the session, my name's Simon Dennis. I'm the interim Chief Executive and Monitoring Officer to the Police, Fire and Crime Commissioner, Julia Mulligan. Julia is unable to join us this afternoon and has asked me just to coordinate discussions. This is the seventh of our sessions of public updates in relation to coronavirus, insofar as it relates to North Yorkshire and the City of York, and Julia felt it was very important to continue with the session. We have, of course, moved past the initial kind of civil emergency phase and through into a period of easing of lockdown, but there are still some quite important matters and one or two issues that I think the public will expect us to update on. So if I could just start by colleagues perhaps introducing themselves as well to the public, and then maybe we could progress discussions from there. So could I start with you, Lisa?
Yes, so good afternoon, everyone. I'm Lisa Winwood. I'm the Chief Constable of North Yorkshire Police.
And Richard?
Yes, thank you, Simon. Good afternoon. I'm Richard Flinton. I'm Chief Executive of North Yorkshire County Council, and I also chair the Local Resilience Forum.
Thank you. Well, Richard, perhaps if I could start with you then, if you wouldn't mind just setting the scene for our communities in relation to the key work streams that are underway at the moment, as we move into planning for and dealing with recovery matters, and also preparing for any issues around the need for lockdown of any sections of our communities. If you wouldn't mind just covering off those themes for us initially, that would be really helpful. Thank you.
Okay, thanks, Simon. And in setting the scene, I think it's probably helpful just to paint the picture of how the virus is operating across the county area, and maybe to give that some sort of national and regional context as well. So we are in a place of having relatively low prevalence of the virus in North Yorkshire. These things are always relative, of course. However, having said that, we've seen something of a slight increase over the last 10 days to a week. So to give some numbers around that, looking back about 2 weeks ago, we had 3 cases per 100,000 population. This is how these things tend to be measured. And today we're at round about 6 cases per 100,000 population on a 7-day period. So across the county today, you would extrapolate that and times by 6, and we would be in the region of 36 to maybe 40 cases taking place in a week across the county. Now, if we cut that quite a bit lower than the national average, and quite significantly lower than the rest of some places in the north, where we've got very high prevalence immediately to the west of us in local authority areas like Bradford, but also Calderdale, and then moving further into Lancashire. And Oldham at the moment has a very high level of infection. So you're at above 70 cases per 100,000 to give the comparison to the North Yorkshire situation. So overall, we are doing well as a county area. There are some variations around the county in respect of that. But no single place that's giving major cause for concern. But it does mean that the virus is still active, so we cannot be complacent. We've got to make sure that all of the appropriate warnings are followed, and good practice measures of washing hands, keeping distance, wearing face masks, and all of those types of issues. What we are seeing is that there are occasional small-scale outbreaks taking place across the county area. So we've had an incident in a pub, a number of incidents in workplaces, some again are continuing to have some small-scale incidents in and around care homes. And we are responding to all of these with colleagues from Public Health England, and looking to make sure that we understand who's been affected, we get their contacts, we play those into the national test and trace system, and the contacts that people have had are followed up, and we try and close down those outbreaks as quickly as we possibly can. And that work is taking place and going very well. So there has been a number of outbreaks. but we are reasonably happy that we've managed to get onto those quickly and stop anything larger from taking place. But we've all got to be on our guard, and therefore anybody who feels they've got any symptoms whatsoever, the usual COVID symptoms that are very well known by now, then please get tested, and then you will yourself, if you have a positive case, go into the test and trace program so that we can try and stop any further infections as soon as we can. In terms of ongoing work streams that we're looking at, Simon, there's a number of phases. So there's clearly the economic recovery issues that's led by all councils, the county council, our district councils, but also the North Yorkshire and York Local Enterprise Partnership, and a range of actions taking place around that. The county council with our district councils are working with individual tourist businesses and retailers to make sure that people can move around streets freely with confidence, to try and keep those businesses open and as vibrant as we can possibly make that. The Chancellor's scheme to encourage people to go into restaurants and pubs seems to be working well. And indeed, the county, as probably everybody is realising, is very busy, from staycation guests coming into North Yorkshire and visitors. And so that is an encouraging sign of the tourism and hospitality sector of the county starting to revive. And we have no indications particularly that we are getting issues in terms of increased prevalence of disease in relation to those types of venues. So we're very pleased with how venues are operating, making sure they follow very good and sound procedures. So we're very grateful for the cooperation that we've had. We may well get some incidents, and we just need to deal with them as they arise. The other areas that we're spending some considerable time on is looking at schools opening in September, not far away now. And been working very closely with all of the heads and academies, etc., to understand what sort of working arrangements they need to put in place to make sure that the schools can open safely across the board for the first time since we've had the coronavirus incident. Getting children to school is a major part of that. And we're working hard with our transport operators to make sure that we can put safe practices in and transport kids into school as well. So lots of work happening on those fronts. And I think those probably are the main points that I would cover, Simon, in terms of issues, and happy to pick up any questions from there.
Yeah, thank you, Richard. Grateful for that. I think it's a point that you sort of touched on briefly there. Presumably, we do maintain strong links and co-working with those areas whose experience in relation to the virus is just that little bit more sort of intense and difficult, and those neighbouring areas that are in what are described as local lockdown. What do those partnership working links look like?
We do, and we have a very active group across the whole of Yorkshire that brings councils together and key experts from Public Health England, playing into the national test and trace teams as well. And we're sharing experiences. What is it like when you are in a local lockdown? What are the particular measures that councils put in place, and what are the most effective measures to try and get a hold again of the virus, and so that we can get lower infection levels in those places? So we are learning lessons. Yesterday we were sent some very interesting and very detailed information on experiences from the Leicester lockdown, what worked, what didn't work, and where partners and colleagues in other parts of the country are very giving in terms of sharing this information. And we are keen to make sure we learn, because whilst we are feeling that North Yorkshire is in a relatively good place, we are all too aware that that could change, and we need to understand and learn lessons.
Well, yes, absolutely. It's a question I was going to ask you. I mean, the public will no doubt have, heard about the possibility of what's described as a second wave, or the combination of circumstances that can arise in the winter in relation to ill health. What planning is underway in relation to those kinds of possibilities, Richard, through the local resilience forum?
There is quite a lot of planning, and particularly involving our partners in health. One of the issues that we are concerned about is the coming together of a second wave with the traditional winter flu season. So we are looking at projections around that, measures about increasing the normal flu vaccine uptake, and what we can do to make sure that we understand the type of normal flu situation we may get, and then layering over that a number of different scenarios as to what a second spike may look like, and planning jointly together, local governments working with the health service and planning how we would react to different scenarios. What's the level of capacity that we would need to step up? How do we need to make sure that a health service works with care providers and care facilities, and to understand generally how teams stand after already working for such a long period on this particular problem in terms of individual resilience and collective system resilience to carry on battling the virus throughout the winter period. So there's a lot of contingency planning taking place and some very good lessons learned, which we hope will make us as ready as possible for what could happen.
Thank you, Richard. Grateful for that. And in terms of the body that sits to deal with the possibilities around local outbreak, every area has established a similar sort of local outbreak board structure. How can the public engage with that process if they choose to do so?
Well, it's quite a timely question, Simon, because we've just had our local outbreak board meeting this morning, which is videoed and put live out onto a web broadcast. And so if anybody is interested to learn more about it and to follow it, then they can actually follow the whole of what the outbreak board is doing. Information about that can be obtained from the County Council website. If anybody has any particular questions or points that they would want the outbreak board to attend to, then they could write into the County Council, address any questions to me directly, and I will make sure that they're fed into the outbreak board. And it may be that we can answer them outside of the board, but if anybody has any concerns or issues, then Simon, I would advise that they contact us, and we're happy to deal with them immediately if we can. And if it's a matter that the outbreak board should cover, then we can feed that into that forum as well.
Thank you, Richard. Now, I'm very grateful. Thanks ever so much. Lisa, could I just turn to you then briefly, just to refresh our community's understanding of the part that policing plays, both in the local resilience forum, but also in those outbreak management boards?
Yes, absolutely, Simon. And as people will know, this has been a partnership approach right from the outset of this health crisis. So working very closely with Richard and his team from a local authority perspective, but also across with health partners, voluntary sector, and all sorts of other agencies that come round the table through the local resilience forum relationship, which is there year round. But then we set up what's called a strategic coordinating group to make sure that the right people from those local agencies are sitting together and considering the information about the health crisis, and then putting in place measures that can protect our public from harm. So that has been in place throughout. It's on pause at the moment because, as you've heard from Richard, some of the levels, the low levels that we're experiencing in North Yorkshire, and that's thanks to the public taking their civic responsibility for going about their business, wearing masks, washing hands, and following the guidelines. So we're very grateful to the public for that, but we want to maintain that level. And as you heard from Richard, things are going up slightly. We're bound to see, as people start to move around a little more, that contact happens. But we would urge the public as a partnership to continue on this journey now and work with us as a partnership. So policing absolutely has a role to play in that. As people will have seen, our officers, staff and volunteers have been out there on the ground right from the outset. The health protection regulations have come in stages throughout these periods. So if people just reflect back to the very start of the outbreak, it was very much lockdown, people being restricted on making journeys other than essential journeys, lots of working from home. And of course, North Yorkshire did play our part in trying to protect our communities and be out there exercising what we call the 4 E's to remind people, which were to engage with our members of the public and our visitors, explain to them the risks of the virus and the things that they can do to help themselves to be protected from its spread, encourage them to take those steps and to not make those essential journeys, and only finally, as a last resort, to use enforcement where we couldn't encourage those members of the public to take that civic responsibility and help their fellow communities to stay safe. But of course, as the weeks have gone on, we've seen some of those health protection regulations change. So you now can move freely. People can go back to work, but we've seen different health protection regulations come into force, and some that you've just spoken about in some areas of the country, not in North Yorkshire, have created an additional lockdown. And close by for North Yorkshire, I know there have been concerns from the public in some of our near neighbours in West Yorkshire about visitors coming over into North Yorkshire, and they of course are in a higher prevalence level of the infection being spread. So fully understand the concerns of those members of our communities. So policing is out there still to protect you in partnership. Face masks on public transport, in shops, etc. People will have seen the regulations there change, and we are working in partnership with our transport colleagues and with shops to make sure that people are encouraged to wear their face masks. Again, the 4 E's approach is adopted for these cases. So we will support those colleagues in shops and on public transport, but only as an absolute last resort if people can't be encouraged to see the benefit for themselves. But also an important message is there are quite a lot of exemptions in terms of the wearing of face masks. So we'd urge the public to be good citizens, and there will be people out there who can't wear a mask for a certain reason, and to be supportive of social distancing, still taking some of those measures that can protect our public, even though some members of the public can't wear masks. But just a reminder, I would really urge people, support each other, wear your masks on public transport, in the shops, if you're closer than 2 metres. And policing has also got that Public Health England advice in terms of protecting members of our team and helping us to protect you. So I know there are some questions about how our officers and staff go about their business. So we use Public Health England advice and guidance. We have a very clear spreadsheet that is educated to all of our staff, is communicated to all of our staff and officers. So if they are outside of a 2 metre distance of somebody with no apparent risks, they don't have to wear any PPE, as would be normal for the public. But of course, if we get closer than that, the advice to our officers and staff is that they will wear masks to protect the public, or if people indeed have COVID symptoms, or we are going to an incident where we know the person has told us on the telephone they're experiencing symptoms, both our staff will be protected with PPE, but also we ensure that we want the public to feel protected when they're in contact with the police. And just this week, we've had some additional advice about our officers and staff wearing masks if they're in close proximity in vehicles. So we're encouraging all of our staff to take that guidance very seriously, so that we can all remain well, because if our workforce are fit and well, we can come out and support you to stay well and protect you from harm. But policing continues. I know we've had some questions from the public about concerns about drug dealing, particularly during the COVID period. And yes, absolutely, we have continued throughout COVID to run drugs operations. I wouldn't want to share, obviously, protected tactics in this forum, but we deal with drugs intelligence absolutely every single day. So those people, and we rely on you, the public, our eyes and ears, to ring in and tell us if this sort of activity is going on in your local community, because we are out there on a daily basis, executing drugs warrants, stop and searching people, tackling drugs on our streets. Despite the COVID crisis continuing, we want to protect our public from all sorts of crime, disorder and harm, alongside our partnership role in terms of COVID. So there are some concerns about people travelling from high-risk COVID areas to North Yorkshire, and that link with also drug dealing taking place. We work very closely with our partners in our neighbouring police forces to tackle that movement of criminality across our borders, but we can only do that with your support and intelligence and information that you can provide to us. So please continue to contact us with that information. We saw quite a dip in crime at the start of the COVID period. Majority of that was caused by people not moving around and the lockdown. We've continued to see some forms of crime remain low, and again, just really encourage members of the public to report anything to us. We're out there delivering a normal policing service now, so please contact us if you need the police, and we really want to ensure that we keep those crime and disorder levels low, and we support our public to be safe and feel safe during this period of time.
Lisa, thank you, and that's really comprehensive and picks up a number of the points that the public have raised with us in the preparations for this particular session. Really grateful for that. Just on the point around complete clarity, I know there is a degree of confusion, and it underpins one of the points that a member of the public has taken the trouble to write in about in relation to those areas that have what are described as local lockdown. That are nearby to North Yorkshire. Is there any particular role that North Yorkshire Police will play in terms of those arrangements and people either visiting those areas or coming into North Yorkshire? It just would be helpful to clear that up, for the record, wouldn't it? So can I come to you on that one? Absolutely, yes.
And the health protection regulations, as you've said, are different in different parts of the country. So as Richard has quite rightly said, there are no lockdown areas in North Yorkshire itself, but we do have some neighbouring communities that have specific lockdowns. So the health protection regulations are designed by experts in discussion who are health experts and other people who sit around the table with our government, and those health protection regulations are set as a result of that expert advice. So in those lockdown areas, there are zones, and within those zones, there are certain restrictions on certain premises being open, people being in each other's houses and gardens, etc. But those zones are zones, and there is no role for us to play in terms of people moving in and out of those zones. So people are entitled to move freely across those zone boundaries. But of course, if they have COVID symptoms, the regulations are as they were originally, that people should remain at home, isolate, their family should isolate with them. And as I've said, in some of those lockdown areas, there are restrictions on movement in numbers of people who can visit each other's homes and gardens, etc. But in terms of people visiting North Yorkshire from those areas, there isn't anything the police can do to stop people travelling across those zones. But we would obviously urge people, if they have the symptoms or they're at risk and they think that they've got COVID, is the advice is to stay at home, self-isolate, prevent the spread of the infection to other people.
Thank you. And a similar sort of point to the one that I raised with Richard, really. I know that we maintain strong links with our neighbouring forces as well in relation to those kinds of arrangements and also to learning generally. Are you able to say a little bit about how that works regionally?
Yes, so absolutely. We have regular meetings. We're involved in national level meetings in terms of COVID updates for the police and how our partners respond. And that then filters down to a regular regional meeting. So that's all of the forces that cover the North East region. So the 7 forces that get together regularly with our chief officer teams to discuss how we are ensuring that we protect the public as a whole, as a region, and we share best practice. As Richard has said, there's some great best practice being shared from colleagues in Leicestershire. So we do the same in policing. So much as those relationships are there in terms of travelling criminality, we do the same in terms of keeping our public safe more generally and how we're enacting those regulations and supporting each other.
Lisa, thank you. And that does pick up the questions that related to policing matters. So thank you for that. And that just, I think, leaves us with one matter that arose in terms of public questions, which is a matter I was going to turn to you about, Richard, if that's all right. So a member of the public has indicated that they've had some feedback from a particular care home to say that that care home is awaiting guidance from the council about family access to the interior of the care home to make a visit. Now, I appreciate you won't be able to answer that question specific to individual circumstances, but are you able to say anything about the general guidance as far as family access to care home premises is concerned?
I am, Simon. Yes, and we have provided some guidance, and there's more guidance coming out as well. Broadly, it is to help care homes take decisions in their own individual circumstances. So what we're saying to care homes is that they should consider individual residents and their need to have contact with people. Clearly, it's very stressful for people to be away from family members, to not have contact, and we are asking care homes to understand the impact of that on individual residents, and then to balance that need against what risk may be presented by somebody coming into the home, and to understand how they can reduce that risk by taking proper measures of where the visit might take place, the usual types of procedures in terms of face masks and distance and the use of hand gel and those types of circumstances, and asking care homes to consider how visits can take place, but also the level of risk in terms of somebody's condition, but also their need for physical contact. So it's a series of questions, I suppose, and guidance for care homes to ask themselves and to consider in order to understand the arrangements they could put in place so that family members and loved ones can appropriately see residents moving forward. And it's we get the point that this has been going on for a long time, and it's very stressful not to have that personal contact.
Thank you, Richard. I'm grateful for that. And in relation to the particular member of the public that's written in, we, our respective officers will work together, I'm sure, to craft a bespoke response to that particular question that the individual member of the public's written in about. So we'll link in with you about that after this session, if that's all right. Colleagues, thank you for taking the time. Were there any matters that you particularly wanted to cover that I haven't asked you about? Seemingly not. Well, that's good. So in which case, we're due to convene again in due course, and I think there'll be others that will join us in those discussions. And at that stage, Julia will be back in the chair. So can I thank you again for taking the time, and we'll close the meeting at that point.
Thank you very much.
Thank you.